Okay, I want to share a case with you I think is really, really interesting, something that you should be watching out for. So I have a patient who is a grandma, and she wasn't getting results with a chiropractor that she was seeing close to Fort Collins. I'm in Denver, so it's like an hour and a half away. Anyway, she found out about me, came down. We noticed that she had a translation and a rotation of her pelvis. We started working with her. She started getting better. Her daughter, her name's Liz, wanted to come in and get checked out for headaches and migraines and stuff like that. So I was doing an exam on Liz, and I noticed that Liz's daughter, she's about 5 years old, her name's Elena, and Elena wasn't tracking with her right eye. As I would watch Elena, she would turn, and her when she looked with her eyes in one direction, her right eye would stay fixed in one position. And I was like, have you noticed this? And she goes, yeah, I sort of noticed that her eye hasn't been tracking right. And I said, bring her up here on the table, let me check her. And so I checked her, and her second cervical was way subluxated. And I told her, I says, this little girl has had an injury in her neck. When did this start? So she says that it had started recently, and she did have a fall. So she hadn't taken her to the doctor, but she had noticed that her eye wasn't moving correctly. So I said, let's get her x-ray. So when I did the x-ray on her, this is what I noticed. Okay, and if you take a look over at this x-ray over here, one of the things I noticed is that, first of all, she had a forward head of 14 millimeters. But also, if we look at where these arrows are, she has a jump in George's line. If we look at C2 along the back, it's stair steps to C3, and again, stair steps over to C4. And her neck is completely flat. So she had a trauma up here, which if you see subluxations up here, C2 will usually affect vision, okay? And there's some of the studies in a research book from the Behavioral Journal of Optometry that talked about the anatomical direction of what happens to people's vision when the C2 is subluxated. So when we went in and we looked at, like we did an extension, we also saw that it started to line up better except for this particular area. Anyway, what I did was I got them both on a program, started adjusting her. After the third adjustment to this 5-year-old girl, her eye was tracking perfectly normal. So one of the things you always want to look at is see, kids don't have pain. But what you want to do is understand our core philosophy of chiropractic is reducing subluxations to maximize nerve function, okay? Now, she could have gone through a whole rigmarole of tests and studies with ophthalmologists, and nobody would have found anything. But we were lucky to notice that and then tell her to get that checked. You always want to have, when you have a patient, you always want to tell them, bring your kids in, because you don't know if they're subluxated, because the subluxation doesn't cause any symptoms. So we always want to check to make sure, is there a subluxation there or not, because it could cause future manifestations, as we all know. In this particular case, I was lucky to actually be able to see the little girl when she turned her head that eye wasn't tracking. There's a good tip for you. I hope that that's something that you could use in the future, and keep focusing on our website, because we're going to have lots of tips coming to help you out with your practice.